Allô, Monsieur Potter. Comment ça va aujourd'hui? OK. Est-ce que vous pouvez me dire votre date de naissance? Est-ce que vous préférez que on vous enseigne dans une autre langue aujourd'hui?
Yes, please. I prefer English. I don't really understand French.
No problem. So, Mr. Potter, can you tell me your date of birth, please?
I was born 1978, November 2nd.
Great. Okay, so how are you feeling today?
I'm feeling a little anxious.
Yes, because of your new medication?
Yeah.
Yeah, okay. So today I'm here to teach you how to administer it. Is that okay with you?
Yeah.
Yeah? Okay, so it's Lovenox, which is a low molecular weight heparin. Do you know what that is?
I know it's an anticoagulant for my blood to prevent it from coagulating.
Yes, exactly.
Okay.
So you are at risk for deep vein thrombosis, and this will help prevent it.
Okay.
Okay? So are you feeling comfortable today about learning how to administer it?
Yeah, I'm a little bit nervous. I don't know much about it.
Okay, do you think you can learn to administer it yourself if I teach you today?
For sure, I feel ready.
Yes? Okay, great. Do you have any support group that could be there with you in need?
I have my husband.
Your husband, great.
Yeah.
Perfect. So you think you'll be able to administer it yourself, or would you prefer your husband to help you with it, or?
I think I can do it alone.
Great, perfect. So let's start?
Okay.
Okay. Okay, so Mr. Potter, are you ready to learn?
Yes, I am.
Okay, so I'm going to show you how to administer it on myself, okay? So this is it. Okay, this is your Lovenox syringe. It's going to come prepared, like pre-prepared, with the dosage already in it from the pharmacy. You'll want to double check just to make sure that they didn't make a mistake, which can happen. And it's normal that there's going to be a little bubble of air on top, but you leave it there because it's counted in the dose.
Okay.
Is that okay?
That's perfect.
What is great about low molecular weight heparin, so Lovenox, like you're going to get yourself, is that you don't need as much blood tests as normal heparin since it's more specific. So that's a good news, right?
Yeah.
Great. Okay, so you're going to take your alcohol swab and you're going to clean it. It's from your belly button about 2 inches, so about here. You're going to clean for 30 seconds. Then you can leave it up here, like stick it here, so you know that you cleaned this area. Okay, so I'm just going to take it off just because it's going to fall. Then you take your syringe, leaving the bubble on top. You uncap it straight, and then you pinch to make sure that you get in the fatty tissue and not intramuscular, because you want it subcutaneous, which is in the fat.
Okay.
And then you're going to administer it, holding the syringe like a pen, administering it at 90 degrees, and then pushing the plunger like this, and then taking it out at 90 degrees. And then when you're going to push on it, there's a security cap that's going to come on, like here. So there's no way that you can touch the needle. And then you're going to put it in the biohazard.
Okay, great.
Great. So now that I showed you how to do it, do you think you can show me how to do it on yourself?
Yeah, for sure.
Okay, great. Without actually administering it, I'm just going to see if you got the hang of it.
Okay, so I would open my alcohol swab
Yes.
and take a place on my abdomen that's 2 inches away from my umbilical.
Great.
So I would wash it
Yes?
and wait 30 seconds. We'll wash 30 seconds and then wait until it dries. And I would
Perfect.
put it up here to know where I would pick myself. I would take off this at 90 degrees
Yes.
so I don't break the needle. And then I would just take my fatty tissue and inject it at 90 degrees, push it in, and then take it out again at 90 degrees,
Yes.
and then push it completely out so the safety cap comes out.
Just like on this one.
Yeah, and then I would put in the biohazard.
Perfect. So you're all ready to administer yourself Lovenox. Okay, so Mr. Potter, did you understand clearly the teaching you received today?
Yes, I feel very confident in administering this medication alone at home.
Perfect. Okay, so Mr. Potter, do you have any questions?
Yeah, actually I did have questions. When you're injecting,
Yes.
would I always inject at the same area?
No, you would change the area, but making sure that you're always 2 inches from the umbilicus.
So I can really pick anywhere in the abdomen, but just two, okay.
Like, yeah,
Okay, perfect.
inches.
In the fatty tissue.
in the fatty tissue.
Okay.
And you do not need to aspirate before administering. So you just push the medication in, and no massages afterwards, because that could cause a hematoma, and we would not want that.
Okay, and also, and you, for the needle, I can reuse it, or?
No, you never reuse the needle, and you have to make sure that it stays sterile. That's why we're taking the cap off like this, and then we're not putting the syringe with the needle anywhere else. So you're gonna keep it in your hands, and then you're gonna administer it. So when you take the cap off, it's because you're ready to administer it.
And then I would dispose of it.
You dispose it in your biohazard, and when this is 3/4 full, you would bring it back to the pharmacy, and they will destroy it for you. But you never reuse it.
Okay. And are there any adverse effects for taking this medication?
So you have to look for excessive bleeding. So it can be excessive nosebleeds. It could be bleeding from your gums when you're brushing your teeth. It could be blood in your urine, blood in your stool, or even vomiting blood. If you get any of those symptoms, you should call your physician right away and tell them about it, and mention that you're on Lovenox. And also, you can use a soft bristle toothbrush that could help not bleeding from your gums, and also using a clipper instead of a razor, because there's more chance of cutting yourself with a razor.
Okay, perfect. I'll try to do all these things.
Great. Okay, so Mr. Potter, if you have any more questions or concerns, please let me know. I hope this helped. Have a nice day, and I'll see you later.
Okay, goodbye. Thank you.
Bye.